All right, welcome to the premiere episode of season 3,
Yay.
Amani. Premiere episode of season 3, Empowered Voices, Recovery to Resiliency. I'm your host, Dr. Farzad Kamyar, joined by my wonderful co-host, Miss Amani Wilson.
Yay.
Amani.
So in today's episode, we're going to take a closer look at what we call peer recovery support or support specialists or certified peer recovery support specialists and how they basically change lives.
Yes.
We're hoping to share sort of like lived experience, they build trust, foster hope. And I want to say they're providing a vital connection for those that are navigating recovery and in our sort of sphere that we specialize in for pregnant and parenting and postpartum individuals.
Yes.
So we hope that our listeners, our viewers, right, will come away with a deeper understanding of what peer recovery support is, what they do, and what their value add is to the system and to individuals in recovery, because they are, I'm going to say, mission critical.
Yes.
Mission
Yes.
critical,
Agreed.
valuable members of the healthcare team.
I like to say God sent little angels.
Oh, yeah. Amen. We've been told that plenty of times, too. Seriously.
Well, it's wonderful because you deserve it.
Yeah.
Well, joining us today are two wonderful special guests from Empowered in Utah, serving Weber and Davis counties. First, we have Elizabeth Myers. She is a certified peer support specialist in a person in long-time recovery. She serves as the chair of the Addiction Recovery Council in Weber County, serves on the Criminal Justice Council in Davis County, is a board member of the Utah Peer Network, and serves on the steering committee of the Weber County Sheriff's Reentry Coalition. Elizabeth is passionate about helping others, building connections, and inspiring women in the Empowered program. She continues her education and community involvement to create opportunities and spread hope. Welcome, Elizabeth.
Thank you.
And we also have Sabrina Samora Flores. She is a peer recovery specialist who draws from her own journey in recovery to connect with others. As a mother of 4, she is committed to setting a positive example and helping individuals build resiliency through trust, support, and lived experience. Welcome, Elizabeth and Sabrina.
Thank you so much for
Welcome,
having us.
welcome.
For having us.
I first want to ask you guys, what does Empowered look like in Utah with your partnership with the Intermountain Health?
Okay, so with the PATH program, and
Yes.
that's what we have, we are able to connect with all the providers. We're all one team. You know, we not only do we get referrals, direct referrals from the Intermountain, providers, but we also connect and start having those conversations on what is the best support for them. So they do the provider piece, and we're able to do the peer support, and then the wraparound services. So they have a medical team, and then we have the everyday supply team is what I guess you can call that, right? Just from their day-to-day needs, and then their medical needs and their perspective to be able to make sure that they're being able to be their mental health as well as their physical health and the baby are all healthy and doing well, and having that structure that they can count on for not only their day-to-day routine but also their medical pieces as well. So as a team, we are able to navigate with them. We actually are able to go into the hospitals, and we've done quite a few doulas roles right now. So as far as going into the hospitals, navigating the detox with them, even in the hospitals, some of the girls we do need to go to detox. And so with Intermountain, we navigate with them and stay with them while they're doing the detox, not the whole time, but just to get them set up, right? And then if they're going to have the baby, we are actually able to go there, be with them, be their little doulas. We're actually considered the care team. So we're not that person that will count as a person that they will have in their room. And, help the nurses and everything kind of do the whole rotation, making sure that our client is doing well and how, coming up with the birthing plan. just that whole labor process, and then we help navigate their post process. Was able to see 4 babies being born, which was absolutely amazing, because even though I have 4 kids myself, I never actually saw that process. But helping them navigate with the medical providers is huge.
Yes.
Because a lot of for me included, just because, I'm a person, in recovery now, but 3 out of 4 of my pregnancies, I was still using, and for me, it's really hard to have that voice, especially when we've got first-time mothers or, even ones that have 6 children, It's always that stigma that comes along with it, especially if the providers know like they are in recovery or if there is some substance use that's involved. It can get challenging, and it's a fear on our client's position to, we kind of give them the heads up of what's going to happen. What does this process look like? If one of our clients we know that are going to have a DCFS involved, we're able to navigate with them, give them what things can look like, come up with a safety plan, things like that, and advocate with them if DCFS does get involved, we get to be present to help them understand, because at that point, there's so much fear already with just giving birth, right? I have some girls that are like, oh my gosh, I know I'm going to lose this baby. It's just like, okay, listen, I can give you, we've already had those conversations beforehand, but right afterwards, it's like, finally the baby's here. Some of them can feel disconnected to the child because of the fear, right? Or some of them connect really well and they're scared of losing, right? And so we are just that comfort tool for them, and just being able to be that support like all the way around, physically and emotionally. And it's a huge piece, And then not only that, we make it kind of easier for the providers, the medical staff, for us to be able to engage with them, to be able to sum it up in our terms, coming from our end, what the medical providers are trying to communicate with our clients, because sometimes it's really hard because they're so scared that everything's just one tunnel, and so we kind of help broaden that. We expand their kind of way of thinking and being able to take that and understand the whole process.
That is absolutely
amazing.
Thanks for that intro.
I'm sorry.
Let's just go ahead and conclude. I think we went through everything. That was an amazing episode.
Yes. Wow.
Thank you so much for that.
I never knew all of this is really going on. I mean, I knew our program's amazing.
Yeah.
But I did not know, just straight from working hand in hand with the providers. That's an amazing aspect.
They're just a text away if we need them, if we have questions, if our clients have questions about their medical needs or anything like that, even with their mental health, they have we have Dr. Spencer that's on there and Dr. Kurtz. So we are able to navigate with them to make sure that we can get a quicker response.
Is fabulous. Right. Mine is blown.
Okay, you sit and process. I'm going to process as well. Okay, I'm going to take a mini step backwards.
Okay.
Cool. For those of our viewers and listeners that don't even know what a peer recovery support specialist or a peer recovery specialist is, can you give us the one-liner, effectively, right? It doesn't need to be one line, of what the heck is a peer?
A peer to me is somebody who is helping me through my challenges.
Cool.
Love
Yes.
it.
Okay.
For me, it's a person that has that lived experience. I know what you're going through. It may not be the same story, but I can definitely relate, and I want to help you process everything that's going on in your day-to-days.
Yeah. And for me, I'm just going to take what you said plus what you said. I think that's a wonderful sort of summary. But just sort of to reiterate, I want to just speak a little bit about what is lived experience. So lived experience is when we're talking about from the a medical side of things, a condition, and someone has experience because they've lived it, which means AKA they basically have it or have had it, right?
Right.
Yes.
Okay, so when we're talking about something within the world of mental health, if I'm someone who has major depressive disorder, then I have lived experience in the world of mental health. In this case, it happens to be depression. If I am in recovery from a substance use disorder, then I have lived experience with substance use disorders and I'm in recovery. And it can be really anything. That's sort of how we view it from the medical side of things. Is I could be someone that has type 2 diabetes. So now I have lived experience with type 2 diabetes. And it goes on and on and on. So there's what sort of lived experience is. And then we'll spend, a significant chunk of the rest of the episode talking about the benefits. What does that mean? What does it look like? But dovetailing off of that, so now we kind of know what a peer recovery support specialist is. I keep calling it that, but there's a few different, right? Why did you choose to become one? What sort of drew you to, hey, this is something I might be interested in, and let me pursue this?
Okay, I'll start.
Yeah.
So my lived experience is I've been to prison 5 times. I fought for my kids 2 times. I have 4 kids, 22, 21, 20, and almost 7-year-old. So yes, I've been, like I said, I've been incarcerated most of my life in and out. I have been in my active addiction for quite a while. I had 3 out of my 4 pregnancies as well I used. And the only reason I was clean for the period of time is because I had to be. So I understand what it's like to be in them situation for people to judge you. And when I think about it, like I remember we didn't have no program like this during my addiction. And I remember DCFS getting involved and them coming to my house and like wanting to help me, And I was like, you don't even have kids in my mind. I'm thinking like you have they're like, it's so easy, right? Like they don't know anything about me. I've come from a broken family. My dad's incarcerated my whole life. My mom was kind of in her addiction as well. So like my lived experience is like I fought for my kids. My last baby, my little True, he's my purpose for sure. He keeps me going. It makes me sad even thinking about it. But he's definitely my purpose right now, the 7-year-old. He's almost 7. And I had him in prison and I didn't get out till he was a little bit older. And just that bond. Like I know that no matter what, some people, so when I see girls with their kids, I know they love them, right? I feel like some people don't know how to love.
Yes.
Like if you're fighting for your kids, you love them. So some people just don't understand what everybody's love is different. Some people don't know how to love. So that's what kind of drew me to it is like, I know where you've been and let's do better. Like, what can I do to help? Let's fix this. Like, I know sometimes it's going to get hard. And I know living in that lifestyle and being in addiction and then getting sober, being in recovery is totally different. And you're lonely. And the people that you've had, even if it's your family or your friends, that's all you have. So when you're not in that world and sometimes people don't have family and they don't have that support. So just being that support to somebody and being like, okay, what can I do to help you? Let's make this better. Whatever I can do, I'll meet you where you're at. And this job I love because not only do I get to do it, I get to go to them. Like I love my favorite part of the job is the kids. So just watching the kids grow is amazing to me and just being to be where they are. Like you want me to go to your house so you can shower? I can do that. You want me to go meet you at the Social Security office so I can help you with your 3 babies? Let's do it. Like whatever that may be, I just enjoy doing it. And like the notes that they send me or just how I've helped them along the way just means so much to me. So like that's kind of what drew me to it is I know where you've been and I know how it feels and let's make it better.
Yes.
So yeah. Was that
Awesome.
a lot?
Okay, so my story is actually when I was, so all my life, I struggled with my addiction for over 30 years. And so for all my life, I never talked about my addiction. That was something I always was able to keep hidden or I would just keep away from my family. So our family motto was, you don't talk about your problems. That was just it. But my second trip at the Utah prison, I was actually the unit coordinator of our treatment program as well as just general population. So I really got to be navigating through and helping all of these girls. I was the person that had to help get things together or ask the questions that they're not able to ask to the officers and and the leadership of corrections as well. And then not only that, our therapeutic community that we had, I was the mentor, like I was the one that was the talk piece. And I've always been that role in my life. But for me, like I said, while I was there, I realized I'm watching these girls coming in and out of prison, right? In the same term that I'm there. And as much help, and for me, I was gathering resources through my therapist, and the director that I worked under. Like it was a thing. I was just passionate about it, And so one of my therapists was like, that they have peer support. You would be really good at it. And I was like, what is that? But one of my friends actually worked as peer support, and so I started asking questions. My last trip at the prison, I knew I had to do things differently. I was able to get out of prison, stay sober for 6 years, but my first traumatic event, I went straight to my coping was, my relapse. And then I ended up back in prison. So I knew this time around it had to be different. So for me, I thought about, I'm like, gosh, maybe peer support would be it. So when I was relieved from prison, I went and got a regular job, and I went and got myself my own peer support just to start working with somebody. And I realized how much that helped me. And so I did the peer support training out in Utah, and then the next thing I know, I'm working as a peer support. So for me, that's where that story comes from. And 4 years, and I absolutely love it.
A woman wearing many hats, that's for sure. She's
Yes.
doing it.
Yes.
What amazing stories, both of you
Thanks.
queens.
And then we came across the Empowered program, and for me, this is the perfect way to do peer support.
Yes.
Yes.
Support.
Yes, no
I did
other
peer
way.
support the first 2 years, and now it's like this right here, this program makes what peer support should be for anybody, period.
Amazing program.
So continuing off that, can you, and we'll talk about maybe what are some of the traditional roles and benefits, but so you've seen it in two different aspects, or let's say
Yes.
multi-aspects,
Right.
Multiple aspects. What is it that you were doing before, or how was it that you were doing it before, whereas now you're saying, oh, this is the perfect way to be doing it? What are some of those major differences?
Oh, wow. Okay. So with peer support, we just as a peer support coach, not with this program, I was in office. And sometimes I would go out and meet my clients out in the community, and we call them peers. I would meet my peer out in the community every so often, but it was all in-house. So we didn't navigate with them in the community. We didn't do those day-to-day. It was you meet in the office and, provide that support. And then, of course, some on-call type of things. But it wasn't really getting in there, because this population, most of them don't know how to start from scratch.
Yes.
And that's literally what you're doing when you are in your sobriety, trying to do things differently. And for me, I'm, my criminal past and things like that, those types, and it's very common with addiction, right? And so there's just so many different barriers.
Yes.
And with this Empowered program, I am navigating with those barriers hand in hand. We walk along the side of that journey. We're building resumes together.
Yeah.
We're going to
Loved
workforce
it.
services to teach them how to apply for financial aid. Getting
Yes.
these girls to be all cheerleading, for them to go to school.
Yes.
Being
Helping
able
them
to
go to school, yeah.
help them get paid for those fees to be able to get them their GED. We've got girls that are doing amazing things right now, and we were walking right along the side with them from A to B to C. And now it's they touch base with us, and that's one thing, when I was doing just the peer support, it was all about just touching base when they needed it,
Yeah.
right? And then we didn't really engage too much outside of the office. And so with this, we're engaging with them all along the way. DCFS courts, we are doing team meetings. Being able to be that connection to help them navigate them, understand it, and feel comfortable, having that trust with us, and just us being able to tell it like it is.
That is the key.
You know what I mean? Because there's some hard things that come
Yes.
along, and it's you know what? I can tell them, hey, this is going to be hard. This is what you might go through. These could be all the negative things that are going to come about, but I'm right here. You're your support. You're not doing it alone.
What can we do better?
What can we do to help you? And that's huge. It is huge,
is.
So I love it.
I absolutely love it. And if you don't mind, real quick,
Yeah.
I would just love to
Sorry,
say.
we do mind.
But one thing Miss Sabrina had said was she was saying how being a peer support is being someone who's there for someone who maybe doesn't have family support. I have family support, but my family didn't understand drug addiction. They haven't been through it, so it's a different type of support that I was getting from my family than I needed at that time from a peer. And then I love how you said starting fresh, because what are we told? People, places, and things. You got to change them. That's your whole life,
right?
So you really do. And a lot of the times you do not know how to start fresh, and you do. It's different when you have somebody who's never been through the struggle telling you, "Hey, start fresh," and da 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 da. This is what you need to do. And it's like, okay, well, you've never really been where I'm at, da 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 da.
It's lonely.
It's lonely. And then having somebody appear tell you, hey, you need to start from fresh, get rid of this, this, and this. And then you're more likely to respect it because it's like, well, they've been through it. They understand. So I think you guys' roles are key.
Yes.
And I think everybody should have a peer.
Agreed. Yeah. Sabrina, can you tell us, because I want to sort of move to this, of what maybe a traditional healthcare clinician role is compared to what makes a peer different? And then we'll circle back around to my thoughts. But
the difference between clinical and like us? Okay. Well, just having that lived experience, obviously, like somebody that's been through it. Like if I'm telling you to do something and I've been through it is different from somebody that's just reading a book or has had training doing it, right? That's my train of thought on it.
Yeah, 100%.
Yes.
I guess a way that I like to put it is street cred.
There you go, yeah.
Is street cred. I am a physician. Yeah. I do not have an active, nor have I had a substance use disorder. I have zero clue what it is to be in the shoes of someone that has that experience or that lived experience. So I have no effective lived experience. So when someone comes to me, like a pregnant individual that has an opioid use disorder, those are the patients that we see and that we treat. My street cred is effectively zero, unless they're coming to me by way of word of mouth.
I was like, street cred.
Which does happen. And then my street cred is pretty awesome. Okay. But if not, I have zero street cred. And then it's only with serious time, serious trust building, serious empathy and non-judgment, and that rapport that I build with patients over really effectively, it oftentimes has to be the entire pregnancy. Not just like one or two visits, it doesn't happen that quickly. But one of the things that I absolutely love about a peer recovery specialist is that instant street cred.
That instant trust.
Something that in a way that I had zero street cred as well is when I would work at the VA treating combat veterans that would come back with PTSD. Zero street cred. I'm supposed to ask you questions about how you're feeling and what traumatic experiences if you had, and da-da-da-da-da. And so it feels very similar to me, right? I feel pretty awful having to have these conversations and going in my own head, sort of subconsciously, is this person even listening to what I have to say? Like, what is that? And so I am a huge fan. We'll talk a little bit about the benefits of and the evidence that supports peer recovery, right? In that role. But thank you for talking about that. And we can start with, let's go with Sabrina. What barriers do you see? I'm looking for like sort of biggest bang for your buck. So what are the barriers that you see clients commonly face? And then how does a peer help them overcome those barriers? Particularly when, again, sort of coming from my space, I'm like, I can't, from my perspective, it ain't gonna happen. I'm not gonna help.
So I think the one thing that I have seen is relapses.
Okay.
So I think having the person like reach out and take accountability for it, like that is huge, because some people, I think that's a barrier is when they relapse and they don't have no one to talk to, and so they just keep going. Like secrets keep you sick, I feel like. So if they have that person to talk to,
I like that.
then I think that has helped a lot as well.
Okay. Love it. Okay, so in the instance of returning to use, aka relapse, Elizabeth, what are your thoughts? What's that sort of a common obstacle people face, and then peers specifically can help them navigate and overcome?
Well, for one, just being able to be that one support, right? So I've had a peer that it wasn't about the relapse, it was about her use. So navigating with them and kind of just supporting them, because like for me, I have no judgment at all. I want to be there for you no matter where you're at. And for me to be able to go and walk into a detox and to be able to support them while they're doing that, letting them know what kind of resources are available and navigating with them on those type of, to make sure that they can get there, that's going to be huge, And so, I think that might have answered the question.
No, yeah, absolutely did. And so I'm gonna sort of take it from you guys are on this side, delivering the peer, right?
Yeah.
Support. Amani, can you tell us a little bit about what it's like, maybe obstacle-wise, on the receiving end of peer support and how that may have helped you on your journey?
Well, I know if it wasn't for peer support that we have at Empowered, my journey would have been a lot longer, because I know that, like you said, it's the street cred that kind of helps you already put a little bit of trust into somebody. Like, maybe I can trust what they tell me. I can tell you my secrets because of the no judgment. You've been there before.
Yes.
You've done that, And I know that you guys want better for us as well, because you can feel the love. And so having that really made my journey a lot different. It was somebody who was there that I could call every morning to just let you know about what I was going through. I did feel comfortable to let my peer know, if I did use, or that I was struggling with using, or that I didn't make good choices, or whatever, or how I missed my son so much, or just all these different things. And she was there just to even coach me through the decision making with people. I'm very social, and I attract a lot of the wrong people. And so she would give me advice on, how to cut people off, how to, just not deal with certain people, things to look for, and that really helped in that sense. I know when my daughter was born, she was in a NICU, meeting me at the hospital with bus passes so I can go to and from to see my daughter every day at the hospital instead of walking was a blessing. Just things like that always, those are the things that are memorable for me with the peer support that I probably wouldn't have gotten if I was just taking therapy. Like my therapist can't come out in the community with me. My therapist isn't giving me bus passes. I can't call my therapist. Miss Quinny was my peer support at the time, and I would call her at 6 a.m. You couldn't call your therapist like that.
Leave a message.
That part, and we might get back to you, or I'll just see you next week.
Right.
And so just having somebody that celebrates your wins with you and helps you through your losses is super important, and it's the one thing that helped me get through. And just hearing stories, and like I said, like you guys have said as well, is everybody's journey is different. So to hear somebody who's probably been through more than what you've gone through, and just hearing that they don't want you going down that path, and just do things correctly, even when your mind wants to scheme and stuff, and you're just being comfortable enough to just let them know everything you're thinking, and they're like, "Girl, stop."
Can I just comment off that too? I mean, for me, like, it's about, we try to, like, a lot of our girls, we think ahead for them and trying to help them, like, okay, let's be prepared. Let's go ahead and do this. If they're having DCFS, like, we just being a little bit a step ahead with our experience with our clients and what we've learned just with that lived experience on top of our own lived experience in our recovery. It's huge, and so there's just so many different dynamics that can come around, and then we're like, okay, if you want to be on the DCFS good side, let's make sure we're doing this, and this, and there might be a possibility we want to throw this in to make, to show what kind of intentions you have, be ahead, and then they get the impressions like, where did you come up with this? And we get to throw those ideas to them to be able to present for themselves. So that's huge. And then, of course, every single one of our clients are like, gosh, we're role models. we're role models for them.
are.
Some of them we've been to prison with. Some of them we actually were in the streets with.
And a lot
they're
of the
like
moms.
looking at us,
A lot of their moms,
and they're
yeah.
looking at us like, oh my gosh, you can do it. We can do it. It's a possibility. And we've got 2 of our girls that are actually now peer support certified. You know, and so it's really cool to see them now working in the recovery community, and here we are working with them.
Yes.
Yeah, the proof's in the pudding,
Yeah.
right?
It is.
Yeah.
It is.
I want to talk a little bit about what Sabrina had mentioned with the return to use or relapse, because that's sort of one of the things that I feel is the biggest sort of bang for your buck that differentiates. But first, I had mentioned that I have never had an active substance use or one in the past. Flaming hot Cheetos. So
there you go.
That
That's
might
a hard
count.
addiction. That is a hard addiction.
So that might count.
That is real.
Yeah, I have a flaming
get it.
hot
Yeah, those
Cheeto
are
use
mine.
disorder. I like to say that I am in recovery. Okay, but in all seriousness, so the return to use. This is something that we were really working hard, sort of at the state level, empowered level, all these different levels, to change the medical environment's possessive view on relapse, return to use. To sort of go to a basic medical model of chronic issues, right? The term chronic has several things that are the criteria and the definition. And one of them is it comes and goes. It relapses and it remits. So it's not a perfect line. It's like this, right? It's like this. And you hope that the trajectory has an upward slope, okay? It's the same thing with high blood pressure, other chronic issues like high blood pressure and diabetes, yes? People's blood sugars go up and down, but you're hoping over time they improve, right? But fundamentally for mental health, including substance use disorders, when you have a quote unquote relapse, ooh, we come down hard on individuals. So much so that it is a common reason for termination of care, right?
It
so
is.
I am part of a program. It's an addiction treatment center. I go there and I experienced what we call a relapse. Yeah. Maybe they kick me out.
That's been my
They
story.
say, yeah, because this is not uncommon. The comparison is if you're going to a clinic and getting your medication for diabetes, and they noticed, looks like over the past 3 months your blood sugars have been a little bit higher. That's a relapse, right? How many folks are getting kicked out of clinic? How many folks are saying, don't
None.
show up anymore, we're not going to prescribe your insulin?
They're
None.
getting more treatment, probably.
Oh my! You see how? So we're talking about a complete opposite of what should be happening. Okay. Peer support specialists. I feel like it's almost an indirect sort of marriage proposal. This whole through thick and thin.
Yes.
Through thick and thin. That individuals who are receiving those services sort of have it in the back of their head. Hey, no matter what happens, I know this person's going to be there for me. And the same cannot be said for the clinical side of things.
Oh, there you go.
No matter how much I tell people, and I hope history serves right, my actions, I hope I've never terminated care or led someone to feel guilty about having a return to use or a relapse. But still, that's me. There's a whole lot more clinicians out there who are sort of operating under the traditional sense of what it's like to treat addictions. I don't blame them for it. I don't judge them for it, nothing like that. But that's what we're hoping to try to change. But until that happens, I can't think of anyone else that can fulfill that role as good as a peer support specialist. I'm not going to judge you. You can call me and say, I just used for the past 3 weeks. That's why you haven't heard from me. And it's like,
Come on.
Gotcha.
Where are you at? I'm coming up.
That's exactly what
Yeah.
It happens a lot for us.
Yeah,
It
there
really,
you go.
really does.
Yeah,
They're like,
there
where
you
have
go.
you been? I knew something happened, but where are you at? Because I'm coming. Send me your location.
That's exactly how it was for me too. It was like, oh, I know Amani, she'll call when she's ready. As soon as I call, I would think, and what would take me a long time too is because when you're in your high mind, it your mind starts playing tricks on you, and you're like, oh, they're gonna be so mad. They're
Yeah,
gonna think
never.
this, and then by the time you
Never.
call, it's like, like, "Hey, girl, you okay? Haven't heard? You all right?
Yeah.
You okay?"
Did you
He's
get the
like,
messages I sent you?
Yes, all of that. And that makes you feel special
Yes.
and loved.
Especially when we've got our girls that are in family recovery court, in any kind of drug court, or even working with DCFS. You know, when we're part of their team and to help them navigate that, like we have the judges from the family recovery court or their whole team that's in the drug court asking us, "Hey, we know this happened. Can you please reach out to her?" You know, and for them to have that, for us to have that relationship with that team, because you know, there's a lot of them that want the best for them, and usually it's us that's best for them at that point, right? And so to be able to be part of that team in every prospect of the community partners, and the court systems as well, you know, it's huge.
It is
for them to, you know, and for me, it makes me feel good to know, like when I have a judge and I'm in a courtroom and they're knowing that there's a new client in there. They're like, "Oh, is that your peer coach?" And they're like, "Okay, yeah, you're in good hands," you know. And I had that just happened this last week, like, "Oh, you have Elizabeth. That's amazing. Okay, you're good. You're like, I'm glad that she's on the team, you know." And it makes it made my client feel secured in a sense, right? Like, and I told her, like, I'm gonna, you know, and I tell them like it is, like what's gonna be happening, and this is what, you know, and the best base of us, we get to hold them accountable as well, you know, and they get to hold us accountable as well, you know. We play those roles.
Love it.
Yeah, and I feel like I'm not perfect, and just to be able to talk about that as well. Like, I still have my struggles. Like, what you're going through, I understand. And one thing that was taught to me, or that was instilled in my head, was like, no feeling is final. And that has stuck with me like through all the years. So when I get to share that with the girls, what you're feeling is valid, and it hurts, and I know what you're going through, but it's gonna pass. Like, this feeling is not final. Like, tomorrow's gonna come. So, like, just to be there for them and help them get through them moments, because I still struggle myself, and I've been in recovery for quite a long time, and with my job, and I'm human. Like, I struggle. This struggle is probably going to last for a long time. Like, every day is a struggle. And for me as well, and I know what they're going through is a struggle as well. So, just to be able to be that example, and I'm doing it along with you, and being that person is amazing to me.
And it's also amazing just to even hear, like, just hearing you say that, Sabrina, that every day is a struggle. Because I've been, you know, we all struggle.
I stay humble. I stay humble, girl.
You have to.
Stay humble.
I mean, it's always reassuring knowing that. I know when I was, when I first started out and staying abstinent from using, it was really, really hard. And I went a little bit without thinking of meth or whatever, but it came to a point where I had a dream and I felt bad about it. And I'm like, oh my gosh, like I'm dreaming about this. I'm a horrible person and it must mean I'm not done using. And ended up talking to Miss Quinny, peer support. And she was like, no, Amani, that happens. That's the devil, girl.
You're human. You're not perfect. You're human. Me as well. Yeah, it happens.
And when it happens, just, you know, and then also but just having a good team to be able to speak to and
huge.
Just tell somebody, because anytime you tell somebody, that's you conquering it. And just having somebody go through that and you know that, oh, okay, we're all in this together. I'm not the weirdo here.
So yeah, I mean, along those lines, we talked about chronic issues, right? And sort of another one of the criteria is they effectively don't get cured.
Yes.
Right?
Yes.
If something has the potential of getting cured or does get cured, then we don't think of it as chronic, like a chronic issue anymore. So again, like diabetes, we don't have a cure for diabetes. It's kind of always there. It's just how do you effectively manage it? How do you effectively treat it? And that's currently how we also view substance use disorders. Someone could be in active recovery and be abstinent, right? Or for let's call it 40 years. It doesn't mean that it's not a struggle. It doesn't mean that it's not something that they're working on. It doesn't mean that X, Y, and Z can happen and they can go right back to day one. It happens all the time. It happens all the time. But again, we have to sort of recognize that it's okay. It's okay.
Yes.
It's
Like,
okay.
oops, stop. We're not going to do that. I remember what happened last time.
Yeah, and that whole notion of being perfect, we try to adopt that as well. That the road to recovery is not perfect.
It's not.
No.
It's not that
it is
perfect
so
straight
not.
line. So whereas oftentimes we like to think of, oh, well, maybe this is the exception. No. It's not the exception. It's the rule. I expect there to be bumps in the road. But from a clinician's perspective, I'm hoping that bump and that dip really, in this world of synthetic opioids, the methamphetamine now that has fentanyl and,
Fentanyl.
and carfentanil in
yeah,
it.
I hate fentanyl.
For me, that
Hate
dip, I just don't want it to be death.
Yes.
I just hope that dip is not death, because I can work with everything else. I
Right.
struggle working with death.
Yeah.
If someone dies, I don't know how to
Nothing.
continue their care and continue their path to recovery. So now it's sort of wrapping things up. I mean, I can talk to you both for hours
on
and
and
hours.
on. A whole nother
I'd like to
episode.
leave individuals with this notion that, look, there is absolute hope, right? And to actively seek out peers.
Please.
Because they might not exist in your care
Yeah.
treatment team. They might not exist in your treatment program. They might not exist in your community. What can individuals do in order to sort of, advocate for themselves, find those networks? What is maybe just like a specific client story that that's memorable that you can leave individuals with that you think will help? My go-to is always, we have individuals that have been part of our treatment programs. They engaged in their recovery, are active in their recovery, were introduced to peers, and then are now peers themselves. That is like the total pay it
Yes.
forward in my head. But if there's anything that you all can share, anything along those lines.
I have a client who I met her when she actually was fighting for one of her kids, a son, and he was just like 1, and she found out she was pregnant again at the time, and she was thinking about she couldn't handle 2 babies, thinking about giving the baby up, and like she just was having a hard time. She wanted her kid and loved her kid, just didn't understand how to be a mom, and she fought her way to become a better person and to become learn everything she could possibly learn. She had her baby and she didn't think she could do it still. And now she has full custody of both of her children.
Yay.
And she is just doing amazing at being a mother, full-time job, going to school, just doing amazing at it. So just to see her doubt and overcome the fear of she couldn't do it, and she did it. So just to be part of that has been amazing. It's possible.
It is.
Of course.
Well, I have actually a few clients that I've been working with since we started the Empowered program, and their situations were not, the DCFS was involved from the beginning. 2 out of those 3 have actually successfully terminated everything with the court systems, DCFS, and they're truly doing amazing, working, finally getting into a place. There's just, I've got so many stories.
Yes,
but,
so do
and
I.
then, yeah. And then, but just to see them evolve from where they were at, and now they're just telling me all of their successes, and even when their challenges, I had one that was homeless with her baby and just got into her apartment after 4 months. She was working full time, getting her baby to daycare at 5 a.m. We were able to help her with a lift just to get to daycare in the morning so she can get to work before 6 o'clock, because there was no other daycares that were open for her that she can drop her baby off to. And you know what? She never expected a ride home. She was able to navigate that back, going to pick up baby, bus, do the whole routine each day, and she just needed that one piece of help to be able to get to work, and drop off the baby by 5 a.m. So that was one piece, and now it's like she's in her own apartment, and she's and she checks in with me to let me know, does the video calls with the baby, because I was there for the baby to be born. So it's just watching that, it fills my cup. Fills my cup.
It's such a blessing too.
Amani.
Yes. Well, I know that just based off of on our team, our Las Vegas team, just seeing what our peer supports do, it's just so amazing. I know that we have a peer who actually takes time and goes grocery shopping with the client once a week, taking time to help them budget and whatnot. Those amazing things, and just actually being able to one day know that that client will be able to do that on her own, and just sowing that seed is just absolutely amazing, because a peer sowed a seed in me, and look at where God's brought me because of that. So it's just truly a blessing.
We have a great team.
Yeah.
Yes.
No, yeah, I mean, yes. And the individuals that I've been able to work with, experience, the patients, all that. I'll speak a little bit from the medical side because we've touched on it indirectly. The evidence. So when we talk about evidence, right, evidence-based medicine, this is like research studies, right? Research studies. And it does through and through. More and more evidence is coming out because peers weren't really it's been around, but they weren't really a thing up until, what would you say? I'd say
8 years ago?
yeah, let's call it 10.
Okay.
Let's call it 10. When
I've
it first
never heard
started,
of
and
it.
then it's in it, and now I feel like we're really in the spotlight with peers. So what does the research show? Yeah, improvements across the board. So we're talking about pregnant and postpartum individuals. Let's say things like overall health and wellness, better outcomes for pregnancy, better retention in treatment. These are all things that I love. Because it improves the health and well-being of not only the individual, but the generational baby,
Yeah.
Yes.
right?
Yes.
Who's then going to become a toddler,
Yeah.
who's then going to become a full functioning adult, and all those
Yes.
kinds of things. So it is really important. And then that improvement in outcomes. So, one of the other hats I wear is at a treatment program. So at High Risk Pregnancy Center, right, we have maternal fetal medicine specialists and behavioral health care specialists who provide traditional clinical treatment. And outcomes are amazing. However, we understand the importance of all those other things, the je ne sais quoi of addiction treatment. And that's why we do work one-to-one with Empowered. And one of the things that Empowered provides is peer recovery support
Yes.
specialists. And our experience has been no different than what the evidence shows. Our clients, our patients that overlap like this, who are engaged with us and engaged with Empowered, do better through and through and through in every single quality measure. What more could I ask for?
Right.
So I will leave with hoping that our listeners and viewers will just know that this is maybe something that you don't know about or don't have, but go for it. Try to find one. Try to engage with one. Advocate to have one around. Find the online services that you can find.
Nearest recovery community centers.
And if you're in your recovery and have any interest, you be the one.
Yes.
Yeah.
You be
But I
the
was
one.
going to ask you, Elizabeth,
Yeah.
where did you say, because I've never heard of peer support recovery specialist until Empowered. I thought
Okay.
it was an Empowered thing.
Correct, yeah.
Until then. So if I am somewhere where I don't know even how to get a hold, how would I ask for a peer?
I would definitely look over for any kind of recovery community centers for
Okay.
sure. I mean, most of the behavioral health organizations now, like Davis, they all have peer support working as case managers a lot. But if you're trying to look and you don't have insurance or anything like that, or just trying to look for any type of support to engage in community activities or in community support groups that are free, good where to start, it would be looking up a recovery community center near you.
Okay.
Yep.
Recovery Community Center near you.
Yeah.
Yeah, and a lot of states have like an official sort of licensing body that certifies and credentials peer recovery support specialists. So that's also a great place. Like here in Nevada, we have one, right? And so there you can go find information. Hey, where are these folks? Where are these individuals? Give them a call, send them an email, whatever it is. Maybe check out their, social media presence, those kinds of things. I do think it's a mission critical individual as part of the healthcare team through and through.
And our roles too, we navigate in the community and make sure the word is out there, period.
Awesome. Love it.
Yeah.
All right. Thank
Well,
you.
thank you so
Thank you
much.
for having
Yeah.
us.
Thank you. Thank
It's a
you,
pleasure.
Elizabeth and Sabrina, for joining us on Empowered Voices and sharing your powerful stories and perspectives on the role of peer recovery support. We appreciate you guys.
Appreciate you guys. So thank you.
Yeah, thanks for being here.
Yeah.
Priceless. I'll call it priceless.
Yes.
Cool. Okay. Thank you for listening or watching to this premiere episode of Season 3 of Empowered Voices. Be sure to subscribe wherever you get your podcasts as another episode drops in a couple weeks. Also, don't forget to rate and share with others who may find our information and discussion topics helpful. Also encourage you to visit our website, empoweredmoms.org, to share your thoughts on this episode or suggest topics you'd like to hear more about.
Yes, please.
Yes.
If you live in Southern Nevada or in Reno, Carson City, Churchill County, or Lyon County in Northern Nevada, or in Weber County or Davis County in Utah, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance required. Visit empoweredmoms.org for information or to request services. If you live outside of these areas, we encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andrea Peterson and Jason Raw, with production assistance by Rachel Mack. Recorded at the Video Podcast Studio in Las Vegas, Nevada. For information about this podcast and past and future episodes, visit empoweredmoms.org.